Breath in.
National.
And breathe out.
That was a good one. Thank you.
Easy exhale. Let it all roll. You're gonna feel a little push here. Very good. Good. Another little push. Let that all drop away. Very good. Exhale, let that drop. Good. Good. Take your chin and tuck it down. Good. Now let it all go. Looser. Loose. Loose. There we go. Good. 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 Breathe in. Good, a little pressure here, loose. Good. Good. Firm pressure here. A little more. A little more. Good. Easy. Good. Let this ankle loose. Good. And exhale. Easy. Good. The shoulders drop, let this go. Good. On your back. Good. Exhale. Good. When do you go back to school? Sunday. Good. Get out of those tight shoes a little bit. Some barefoot. Rest here. Okay, nice and quick here. Good. On your back.
Houston chiropractor, Dr. Gregory Johnson. I'm over here at my very dear friend and colleague, Dr. Cherry Smithstead at Woodway Wellness. Dr. Smithstead has been practicing 39 years, same as you graduated in 1980 from Palmer, right?
I did. Yep.
So we've known each other since 1981.
Right.
And we've been adjusting each other and referring patients back and forth to each other for 38 years.
Mm-hmm.
Dr. Smithstead is who I come to get my C6 herniated disc adjusted because he does XYZ biophysics. And that's what I need. I've been adjusted by a bunch of other chiropractors in the past that just don't get it. Dr. Smithstead gets it every time, so I make the 40-minute drive to come over here and see him.
Yep.
In a busy part of Houston. He's off 610 in Woodway, and I will put a hyperlink to Woodway Wellness website on this video description box. So just open it up and click on his website and come and visit Dr. Cherry Smithstead. That's who adjusts me.
Thank you.
So let's, yeah, you're welcome, buddy. I love you.
Love you.
All right. What do you
Come on
want?
down here, lay down on your stomach first. And to balance it, this hip will rotate forward. So we're going to adjust that hip back down to get it level with the right hip. Good. So now look at both sides are even.
Yeah, I didn't have any pain coming up either. It's a native knockless.
Yep. Good. Okay. We're going to do what's called a P to A. This helps reinforce, put the curve back in the neck. It's a straight drop. Good. We're also going to bring the occiput, the base up here. Open this up. Good. Lift. Good. Watch this. Hold that arm back that way. See how that's weak? And watch this. Good. Now watch. Pull back.
Yep, pretty strong.
Much better.
Yes, sir.
Good. Now, let's get you on your back. Okay, so we're only getting just limited range of motion to both sides. So we're going to drop that back.
Oh, yes. Oh, thank God.
Good.
Thank God. Turn on the power.
Turn the power on. Now, turn it that way. Good. Into that way.
Yeah, that's
really
better.
Good.
Yeah, a lot better.
Sit up right here, Dr. Johnson. Face that way.
Okay.
You
Oh,
use
that was
this
good.
instrument.
Oh, I see. I feel the
Yeah.
blood flowing in my arms and hands again already.
Drop your head a little bit. Really good. Yep.
I see he's putting things in negative Z and negative theta X in extent.
Designed to do is hold the base of the skull, the occiput, so we can really get it, take it out to tension, take it out to tension. And
Oh,
impulse.
yes.
Good.
I love that.
There you go, buddy.
Thanks so much.
You are
Would you
welcome.
mind hitting my shoulders and elbows and wrists for
Sure.
me too, please?
Yep.
Because he also adjusts extremities too. There's very few
There we go.
good chiropractors that know how to adjust all the extremities as well.
Push up.
Good. Real strong.
Yeah. Turn that over.
Oh,
It's
that's
weak
yeah.
right there. Okay, just drop that down. Just let that go.
Yeah, okay. There we go. Thank you.
Now, let's retest that. Push up. Turn it over. There we go.
Yep, that's better.
Let's see this side. Push up.
Oh, man.
That's real weak.
That's from my C6 brachial plexus being
Yep.
involved.
There we go.
That was great.
Good. Now, let's see this again. Push up. That's strong. Turn it over.
Oh,
And that's weak.
yeah.
Okay, just like that. There we go.
See, it's important to get all of the.
This is just kind of where you just relax into it. I'll create pressure over here on your spine to adjust you, okay? Cool. Breathe in. Easy exhale. Relax your hips. Just pressure. Very good. Good. Look straight up for me. Relax. Come to your right. Good. Let that right shoulder drop. Good. Good. Breathe in. Again, breathe in. Okay, that's it. Now let that flow. There it is. Good. Beautiful. Roll forward here. Good. Let this come back loose. Good. Good. Way to help move it while you're on the road, okay? Okay, let this all drop. Breathe in. And exhale. Good. Breathe in. And exhale. Okay, turn your head to your right. Good. Good. Come on your back for me. Let these legs go straight. Okay. Alright, you're gonna feel a little pull here. Okay. Loose. Good. A little more. Okay. Relax that hip. There we go. Good. Good. Alright, you feel a little on this hip, okay?
Yep.
Let it go. Good. Pull yourself back up a little bit farther. Good. Relax. Just a little pressure here. Good. come on your side. Just like this. So bring your hips under you just a little bit. Let this leg drop off like this. Okay. And your arms are just gonna rest like this. Okay. Let everything go. Relax your shoulders. There's pressure. Good. Very good. Come on your back for me. You good? Yeah. Take a breath in. Easy exhale. Let that fall. Good. Good, relax. Loose. Good. A little more. Good. Loose.
Just his left SI joint first. Using the drop table here, it's drop down. And then his right one, and then I'm going to come straight into this left side of the sacrum and do a superior to inferior and P to A adjustment on his sacrum. And then we're going to drop L5, straight P to A. These are pretty deep, so these might be a little sore at first. Yes, sir. Yep. Oh, I know what I'm going to do with you. I'm going to put you on that knee chest. How long has it been since you had a knee chest adjustment?
Ooh.
Yep. There we go.
10 years.
Yep. Legs are now even. And I bet you that didn't tighten up as badly.
It's better.
Yep.
Definitely better.
That's what we like. Better, better, better. Okay, you're going to feel your head popping up a little bit on this one. And see, his head's heavy because he's got all that knowledge in there. I'll slide down this way a little bit. See that, or he's got a lot on his mind.
That's good.
There you go, good. Okay, let's turn you on your back now, please.
They were calling me fat head earlier. They're going to frame that.
No, I would put it in a nicer way, I think.
All right.
Okay,
See, babe?
let's sit her over here. There you go. So slide down about an inch. There you go. So this is not a face slam maneuver. This is actually, I'm bringing your whole head up past your shoulders, negative theta X, negative S to Z cervical. Okay, now slide down about another inch. And put both arms straight up.
Where you at, Brock Lesnar? You got nothing on that?
Straight out that way. And maybe down about another inch right there. And adjust your AC joints, your sternoclavicular joints, and your intercostosternal joints. Perfect, okay. Let me relax your hands on your tummy. Let me have this right leg here. There you go. And you should have felt that from your knee all the way up into your hip and low back.
Yes.
Good.
Yes.
Same here.
Halfway my soul.
Uh-huh. Oh, that's coming. There you go. That one was a little tougher.
Move though.
Yeah.
Yeah.
Good. Okay, let's sit you face out the window. You can get our good view of downtown Houston from there. So that's the city down there, downtown.
See mosquitoes everywhere.
Seeing what?
Mosquitoes.
Oh. Pretty hot when you got off the plane too, huh?
Yeah. The custom shirt is now drenched.
There you go. Got your elbow on that one too. There. So I adjust all the joints of the body so I can get cavitation of all the synovial joints. It sends a neurological proprioceptive bombardment into the cerebellum, which it then regurgitates and sends out efferent information to the rest of your body's kinesthetic movements. Perfect. Now for the big boy. Come over here.
Uh-oh. It's the one. Is it not? Ready?
Get you a brand new clean towel.
It's like when you're about to get on a roller coaster.
Yeah.
You're a little bit.
Just keep your teeth together. Don't bite your tongue. So I'm wrapping this around his mandible and his occiput. There it is right there. Yes, sir. Now, I really don't have to ask twice if you felt that all the way down.
Oh, yeah, I felt it all the way down.
Don't get up yet. Go ahead and put your hands on your tummy for me. There you go. There, perfect. Yes, sir. Good job. You survived your feet. Close your eyes again. Flex your head forward and backwards again. Neutral. Yep. See, you're more centered now. You were translated in your pelvis and your cervicals, but that's better. Hold these up and back for me. Now go ahead and hold them up and back. There you go. Flare these guys here. Tightens up the whole trap. And then we're going to come straight negative Z, negative theta X. Keep your shoulders squeezed together for me, please, Dr. Hunter. And I'm going to adjust your atlas on the X axis. Okay, you can relax. And this time when you flex your head forward and backwards, tell me if you feel any difference in this one versus the previous two that you did.
Yeah, it's better.
Smoother, huh? Yep, good. So this is Dr.